Hello, NephU community, and welcome to the Hot Topics in Nephrology podcast. I'm Jeff Lockwood with the NephU medical team, here with nephrology writer and editor Mark Newman. Every month, Mark keeps us up to date on the latest hot topics in nephrology. Today, we're going to keep on the topic of public office, and Mark will give us an update on the appointment of new CMS director, Dr. Mehmet Oz, along with the other healthcare appointees in the new Trump administration. Plus, we'll cover the demise of one of the ESRD program demonstrations and some other potential changes to those that remain. But first, we want to update on a story that we've been following for the last couple of months. So we're going to talk about some recent updates in the transplant field. We heard this week that Alabama resident Tawana Looney, who was the longest recipient of a functioning pig kidney, is back on dialysis.
That is correct, Jeff. Surgeons removed the genetically engineered pig's kidney from Looney, who is 53, last Friday after she experienced acute organ rejection, according to NYU Langone health officials. She had lived with the kidney for 130 days, which is longer than anyone else had tolerated an organ from a genetically modified animal. Robert Montgomery, director of the NYU Langone Transplant Institute, who did the transplant, told the New York Times that it was not a setback for the field of xenotransplantation, and here's his quote. "This is the longest one of these organs has lasted," he said in an interview. "All this takes time. The game is going to be won by incremental improvements, singles and doubles, not trying to swing for the fences and get a home run."
Yeah, I think we saw a lot of positives from this. But the big question is, were there complications with the kidney?
They are still trying to review the outcomes, but it appears they had reduced the dosage of the immunosuppressive drugs to treat an infection, and that may have led to the rejection. But they're still looking for other causes.
Yeah, and we had reported in previous NephU podcasts that United Therapeutics Corporation had gotten the okay to proceed with clinical trials using these pig kidneys.
Right. The company expects to start a clinical trial of pig kidney transplantation this year, starting with 6 patients and eventually growing to 50.
Well, we wish Tawana well, of course, but there is some good news on the transplant front that may help extend the shelf life of donated kidneys.
Right. So this is considered a major breakthrough in transplant. Scientists at Massachusetts General successfully froze and stored a pig's kidney for 10 days, then thawed and reimplanted it into the same animal. After the 7-hour procedure, the kidney began making urine. This is exciting because one of the main concerns with donated kidneys is that they have a short shelf life. They have to be transplanted into the recipient in a timely fashion, or the tissues can start necrosing or dying. If we can freeze the kidney, in essence, place them on ice until they are needed, this can help preserve a donated kidney and give transplant teams more options.
And this is very exciting because these kidneys will always be a scarce resource, and time from harvest to transplant is always an issue.
They will. And of course, organ procurement and management is an important topic for the new CMS administrator, Mehmet Oz, who is a cardiothoracic surgeon, and it's an important topic for him to tackle. As you noted, Jeff, the Senate confirmed Dr. Oz on April 4th as the new CMS administrator. Now, of all the healthcare posts in government, this one is of primary importance for the kidney community because CMS controls Medicare and Medicaid expenditures. Medicare covers the cost of close to 70% of the patients with end-stage renal disease, since anyone who is diagnosed with ESKD and needs dialysis or a kidney transplant is automatically covered by Medicare for life. That's a significant cost to the government and taxpayers, both in terms of patients with chronic kidney disease and those with ESKD, already on dialysis or living with a kidney transplant.
Well, has Dr. Oz spoken before the transplant community?
Yes, in a 2019 interview with a Louisville TV station, he did say that organ procurement needed to be a top priority. He empathized with organ procurement organizations and the job they had in obtaining organs. Quote, "The biggest problem is not the UNOS rating system, it's we don't have enough organs," Oz said. "We should do a better job. At least if you do nothing else, get your license and check off the back of it, or tell someone you care about on Facebook or whatever social media you use that you want your organs donated. That way it's public, he said during the interview. Now, the challenge for Oz in healthcare and human services is that paying for treating kidney disease is an expensive undertaking. And here's an example. According to the 2024 U.S. Renal Data System annual report, 15.4% of the approximate 23 million Medicare fee-for-service beneficiaries aged 66 years and older had a diagnosis of chronic kidney disease. And they accounted for over 1/4, which is 26.7%, of total Medicare fee-for-service spending in 2022, or $86.4 billion. So that's $86 billion spent on treating patients with CKD. Now, according to the report, the cost for treating patients with ESKD, so patients already on dialysis with a functioning kidney transplant, have slowed. And here's a quote from the US.RDS. Medicare expenditures for patients on dialysis increased slightly from $45.1 billion in 2012 to $48.9 billion in 2019, and then fell beginning in 2020, reaching $45.3 billion in 2022. And from 2012 to 2019, it accounted for 5.7% of the total Medicare fee-for-service expenditures in 2022, the lowest in over a decade. But that information is important because there is a caveat, and this is an important mention by the US.RDS. It should be noted that reductions in fee-for-service expenditures for ESRD in 2021 and 22 are at least partly related to the patients switching to Medicare Advantage coverage, and therefore these reductions do not necessarily represent decreases in overall Medicare spending.
And that is important because we know the number of patients with ESKD who have joined MA plans has exploded in the last few years, and the US.RDS does not currently include MA costs in this calculation. They only do the fee-for-service costs. We know that close to half of the patients with ESKD have joined MA plans.
Yeah, right, Jeff. And we learned earlier in the month that CMS has approved payment increases for 2026 to ensure that administer MA plans. So you're looking at an increase of 5.6%, a more than $25 billion increase from 2025. That aside, between the two kidney disease states, Medicare spent $131 billion on kidney care in 2022. So it's a big ticket item for Medicare.
So with the new Kidney Care Choices demo, along with new drugs to slow progression of CKD, we are being more aggressive about preventative care. So by the time we see the 2025 data in the US.RDS's 2027 or 2028 report, we may see that costs for CKD care increase. And for ESRD care, it's hard to determine how much of Medicare spending is allotted because that data doesn't capture patients' costs in Medicare Advantage plans.
Yeah, exactly. So the positive news here is that Oz is a fan of value-based medicine. With his master's degree in business, he could help continue these value-based care demonstrations.
So along with Dr. Oz, I think we've kind of touched on this a little bit in the past. Who else is in the healthcare cabinet under President Trump?
Right. So we know Robert F. Kennedy is now leading Health and Human Services, and Oz will report to him. Jay Bhattacharya has been confirmed to lead the National Institutes of Health, which includes the National Institutes of Diabetes, Digestive, and Kidney Disease. And Martin Makary is leading the U.S. Food and Drug Administration. That rounds out the healthcare cabinet. By the way, the US.RDS is funded by the NIDDK. All these departments are laying off employees and cutting program costs. So we hope that the US.RDS survives that. HHS recently cut 20,000 jobs and consolidated 28 divisions into 15 new divisions.
And part of the casualty, or I guess action step, taken by HHS is ending the ESRD treatment choices model after 2 years. But why didn't this model succeed?
Well, CMS's Innovation Center, which manages the kidney disease demonstration, pulled the plug on the project after reviews showed there was no significant increase in use of home dialysis or kidney transplants. More than likely, this was a decision to drop the demonstration due to poor performance versus any concerns about Trump administration cuts to funding the demonstration. Quite simply, the financial incentives in this mandatory model didn't move the needle on getting dialysis providers to place more patients on home dialysis or getting a kidney transplant. Both of those targets were part of the Advancing American Kidney Health Initiative signed by Trump during his first administration in July 2019, and this was a demonstration born out of this executive order. The demonstration had other problems, including the centers that were randomly selected didn't all have active home dialysis programs, so they could not take advantage of the financial incentives.
So, is there concern that other ESRD demonstrations might be in jeopardy?
Yeah, that's not really clear. We're waiting the results from the second year of the Kidney Care Choices model. The first year showed some improvements in care for patients with CKD, but no real savings for Medicare. And as we have reported on the podcast before, the next demonstration regarding kidney care starts July 1st with the Increasing Organ Transplant Access Model, or IOTA. The intent of that model is to increase the number of kidney transplants and improve the consistency of using organs procured in this country. This is also a mandatory model and is set for a 6-year run.
That's a lot of balls in the air for Dr. Oz and CMS in terms of the future of the ESRD program.
Yeah, and I think the mantra for Oz and HHS, is a common formula. Provide better care at a lower cost. For demos like IOTA, it's all about better ways to use donated organs and get more people off dialysis. Can value-based care deliver that combination?
That's the question. And we'll be watching it pretty carefully, I'm sure, moving forward. I think, like every podcast, there's more to come.
Exactly right.
Well, Mark, thank you for joining us to give an update on the fascinating story on xenotransplantation and the development of President Trump's healthcare leadership team. These are some important spots to fill with some major responsibility that impact our kidney community, especially Dr. Oz. We've already seen the demise of the ESRD treatment choices model, and we'll see what they have in store for our kidney patients moving forward. So thank you to the NephU community for listening in. Be sure to like and subscribe to the NephU podcast and all the major podcast hubs. Hope you all enjoyed the conversation, and be sure to join us next month so Mark can keep us up to date on the latest hot topics in nephrology.